everybody. Welcome to today's webinar. We're so glad to have you here and joining us. Today, we're going to be speaking about localization. I'm Joni Watson. I'm the Vice President of Marketing and Communications for the BroadReach Group. It's especially special and a celebration this week as our group has turned 20 this week. And we've worked with so many of you, had a long journey together with aligned organizations that all believe in access to good health that allows people to flourish. This webinar event is part of something that we call the Collaboration Series, where we get some of the best minds and thought leaders within our industry to talk about really critical issues, have a really good conversation. Before I introduce you to our panelists, I just wanted to welcome our, nearly 500 people that are dialing in from all around the world, particularly around Africa. If you're joining us on Zoom, we'd love to have you in the conversation. You'll see on your control panel, there's a Q&A function. Please feel free to ask questions. We will talk through those questions either in the Q&A section, or some of our panelists, as they can, will answer those questions. If you are one of the people that are joining us streaming on YouTube, our YouTube channel, hello, welcome to you. We haven't forgotten about you. You can also ask questions and just pop those in the comments section, and our team will pull those right through so you can be involved too. So, localization, why are we talking about it? Why is it important? It's certainly been a high priority and on the agenda of Ambassador Samantha Powers. And, just this week, the acquisitions and assistance report was put out this week, which is really around tools and means to be able to support non-traditional and local partners. So it's a hot topic right now. And then I think also, as we reflect on this being PEPFAR's 20th year, it's a really great time to reflect, celebrate, and look back on 20 years of impact and how the collaboration and all coalescing around a single issue has really made a huge difference in HIV treatment and care. So we won't just be listening to me all of today. I'm going to now introduce you to our panel. If you can pop on your cameras would be great. So first of all, our panel consists of Dr. Dennis Marley, who is the Senior Care and Support Advisor for USAID in Southern Africa. He's going to really set the scene for us from a USAID perspective on localization and perhaps share some of his local experience. Then we will speak to Mpula King Mashrewa, sorry, I know I've messed your surname up, from Mothers to Mothers. So Mothers to Mothers is one of the first prime organizations that PEPFAR and USAID have supported. And, Mothers to Mothers really has a truly grassroots local business model with starting with local mothers, local women supporting people within their community. So I think through their long journey, she will have some really great insights for us. Next up will be Darisha Naidu. And Darisha is the Chief of Party for BroadReach Health Development's a PACE program, also a USAID and PEPFAR program. And Darisha is going to speak to us around some of the insights that she's gained through her very rural local programs. Next, it would be my pleasure to introduce Batuke Walasiku Mawewa, who is the Country Director for Zambia for the Catholic Medical Mission Board of Zambia, CMMB Zambia. And they've had a really interesting journey in that they have now fully localized and separated from their global organization, CMMB. She's got a lot of insights to share with us there. And then finally, we'll have Amitra Matroa, who is the Senior Technical Advisor for Capacity Building for FHI 360. And she'll talk about localization from a global perspective, from a global implementer's perspective. So let us get started. So our first question is going to be for you, Dr. Mali. If you could really set the scene for us about USAID's localization agenda, why is it so important, and where's it all going?
Thank you, Johnny, and good afternoon to you. Good afternoon, good morning to the people who are dialing in from across the world. First of all, I am very privileged and honored to join you and the expert panel teams that are going to be discussing what is a very passionate topic to me, localization, local capacity. And why do I say this is passionate to me is because I have been involved in USAID operations with local capacity strengthening from, I think, about 2012. If you recall, the USAID forward objectives of the President Obama administration. This was an initiative where USAID set out an ambitious reform agenda to partner with local systems, local governments, civil society organizations, as well as private sector to advance and achieve sustainable development results. This was a very successful reform. Back in the days, after it was launched in 2010, by 2015, the agency had already obligated about 27% of its funding towards local organizations, private sector, and civil society organizations. Coming to now, what is the local capacities strengthening agenda, which is, again, a key priority under the Biden administration. This is a very important agenda, in addition to what USAID has been doing over the years. But first, let me just pause and actually, reflect on what is local capacity and why is it actually important, right? Capacity, of course, refers to, those skills, motivations, or that enable an individual or groups of people, networks to be able to embark on, design, and implement solutions to their own local challenges. By building that, we are able to achieve sustainable development goals. This is very important now with us within USAID. And it started way back, I think, as early as 2021, when our administrator at USAID, Ambassador Samantha Power, was hosted by Professor Hellman, who is the Dean of School of Foreign Service at the Georgetown University. At that very meeting, she mentioned a very powerful vision. She talked about the need for USAID to go beyond, bringing out the development resources on the table to solve development challenges across the globe, looking at what we had done with COVID-19, addressing democracy issues across the world. She said she had a vision. We don't have to bring the resources on the table, but rather, we have to bring a bigger tent that allows people to come together. And what does that mean? It means really key issues for us here. Three important things whenever we are embarking on addressing a development challenge. The key thing is, first of all, to listen to the voices of the people we support. And the second one is really to foster a deeper, meaningful, and real partnership, collaboration with the people we work with. And finally, as we embark on those activities, we should pay specific attention to the voices of those who might be marginalized. This was 2021, back at the time. This was followed by, real action within USAID, where we basically rolled out the local capacity strengthening policy, which is the guiding tool for us at USAID to guide, first of all, how do we engage on local capacity strengthening? Why is it actually important? And how do we hold ourselves accountable to make this happen? And this is a very important tool for us. Since its inception, the tool has actually created a very clear pathway for us to build those strategic and intentional capacity building investments that we need to do as we work with our partners. And the investments are driven by, some sort of key reinforcing principles based on effective partnership and also inclusive partnership. That as we bring help to people, it should not be only because we are coming to help people, but we're coming to partner with the people to be able to identify their issues and develop solutions around those issues. But why is it critical? Why is USAID embarking on this journey all the way from USAID Forward to the local capacity strengthening policy, which is important for us to move forward with our partnership with local organizations? The gist of this is actually really anchored in several of those declarations. You will recall there is the Paris Declaration, there's the Accra Declaration about the importance of effectiveness for foreign aid, and that it's only effective if we partner with people with whom we partner with people who we are bringing the support for. They should be able to identify their issues and design the solutions for that. That makes it effective and sustainable.
Gosh, thank you so much, Dennis, for summing up the position so well. So next we're going to speak all things mothers to mothers. So Mapuleng, could you really speak to us about your journey? I know that you've been with Mothers to Mothers, and I know you're a country director in Lesotho for 15 years. And I think that Mothers to Mothers, and you'll have a really great perspective as you were one of the first truly prime local partners. If you could share your perspective, be great.
Okay. Thank you so much, Johnny. Like you said, I'm Polokem Mohlwai, the country director for Mothers to Mothers Lesotho. And just to share with you, Mothers to Mothers is an African primary healthcare organization that started in South Africa in 2001, but just in one hospital in South Africa. We began with a dedicated focus on ending the PMTCT, which is prevention of mother-to-child transmission. And to achieve this, we developed a unique model that we call mentor-mother model that I will explain further in just a moment. As we began to scale up, we could sense the potential of our model, not just for PMTCT, but to go further, to end AIDS, to create jobs, to deliver health for all. And I'm happy to share that Mothers to Mothers has evolved and grown while staying true to its roots of being an African organization, the peer-based organization. Currently, Mothers to Mothers is implementing in 10 African countries, reaching well over 1 million people a year. And as a country director for Mothers to Mothers Lesotho, I'll just highlight a few points about M2M Lesotho and how prioritizing local needs has led to this success. Mothers to Mothers Lesotho was the second born of M2M after South Africa. We started in 2007, implementing the PMTCT services only through the unique mentor-mother model I talked about, where we recruit, we employ, and we train women living with HIV who work in their communities as community health workers, and we call them mentor mothers. They provide health services, education, and psychosocial support, and promote uptake of PMTCT services to other women in their locales. Over the years, we have grown in many ways. We have started, like I mentioned, we worked only in the health facilities. But today, we have integrated the teams working at health facilities, at door-to-door in communities, providing a strong continuum of care. We have also expanded well beyond PMTCT and even HIV. In fact, our ambition is to become an integrated primary healthcare organization. And through PEPFAR support, thanks to PEPFAR, like Dennis has mentioned, we also received TA from other implementing partners who has specialty on certain areas like cervical cancer screening and treatment, HIV and TB prevention and care, which has helped us to achieve this goal that we have been talking about. Mothers to Mothers Lesotho program has now evolved beyond that initial scope to the clinical direct service delivery of HIV prevention, care and treatment, and even the non-communicable disease identification and management, which is delivered by professional nurses and lay counselors with the same mentor mothers by their side, still doing the case management, psychosocial support, and demand creation. This shows that we have learned from TA, we have applied the learnings, we graduated. Therefore, we are now transferring the skills to even other implementing partners and the communities. So to respond to the localization call, I would say we are a testimony, yes. That services, we know that as mothers to mothers, like I said, we talked of localization. The services need to be done by people and organizations that truly understand the local context and tailored to local need. We want to share our experience of how the localized peer-led, peer-centered model deliver the integrated primary healthcare and achieve remarkable result. Let me say, over the last 21 years, since Mothers to Mothers was born, we have trained and employed around 12,000 women living with HIV as community health workers. And we call them mentor mothers across African nations. These remarkable women that I talked of have reached over 15 million people with health services and education. And in 2021, we even achieved the virtual elimination of mother-to-child transmission of HIV for all our enrolled clients, and that was for the 8th year in a row. The organization has also evolved from PMTCT only to the primary healthcare organization. So this result I have shared, that is so much rich experience of African people, led us to what we call lead with localization, which is our theme for today. Thank you.
Gosh, thank you. I really, really resonate with lots of things you were talking about around really prioritizing local need and seeing how through that you've built and built and built and built capacity. And now you're teaching and training so many other organizations. True success story. So Dorisha, I'd love to bring you into the conversation now as the COP of the PACE program for BroadReach. You really focus on some pretty hard to reach rural districts. I'd love to get your insights on what you do and what you have learned through localization and local needs.
Good afternoon, colleagues. Thank you so much, Joni, and wonderful to be on with my esteemed colleagues this afternoon. So a few things around, a few of my thoughts or insights around localization, given that BroadReach is now celebrating 20 years, and BroadReach has been working in some of the geographies that are rural and peri-urban for as long as those 20 years, especially districts like Ugu district, and then King Cetwayo, Nkangala, and Gersibande. I think a few key things is that there's really a need for having a deep contextual understanding of the communities that you serve. It's really appreciating and respecting local wisdom, local insights, and then working together with communities to tailor interventions that really meet the needs of those communities and the people that we're ultimately serving. The next big aspect to this is we can't, of course, conduct the interventions without fostering those relationships that my colleagues have been speaking about. And the relationships aspect of having deep, meaningful, collaborative partnerships, specifically with our colleagues at the Department of Health, at the various different levels, from a national level, provincial level, at a district level, and then a sub-district level, and then at a community level. Because all the things that you want to do in those communities, you need engagement at the various different levels. Now, when we say we want to engage with our colleagues at Department of Health, it's not just the Department of Health. To provide comprehensive care to communities, you need to be able to engage with other government departments as well. Of course, then we have our colleagues at USAID, our funder, that there's constant engagement with to ensure that we are aligning in terms of the response and in terms of working in partnership with Department of Health, the primary recipients, USAID, and us as the implementing partner. And then most importantly, Joni, it's the communities. It's the leaders at the community level. It's the stakeholders. It's the local platforms that you want to engage on so that you can actually have successful interventions in place and make sure that you have good outcomes. And the last piece, to this that I think we can talk a little bit more about is really around human resource for health, right? Human capital. Now, we all know that working in slightly more rural districts, peri-urban, it's more difficult to find more professional levels of staff at times. I know as BroadReach, we particularly struggle with getting cadres such as professional nurses or medical doctors to go out to some of these rural areas. And I think this speaks to a few things. It speaks to why it's so then important to build capacity at a local level so that you can develop those kind of skill sets. And of course, it's not always going to happen directly through us as BroadReach, but through various partnerships, there are many alternatives or opportunities that one can explore. And then the other thing is that if we look at capacity building of local hires for all the other cadres that we require to really work within our programs with Department of Health and other government departments, it's really leaning on sustainability. And once we have, staff that are local hires being capacitated, you are now developing sustainability. And that kind of also links into your partnerships and relationships. And I think there's great value in that long-term, consistent localization that leads to sustainability and partnerships. If I give you very real examples in terms of human capital or HRH for health, we have multiple staff that joined BroadReach as an organization something like 15 years ago, and they may have joined as nurses in the field or nurse mentors or data capturers. And some of those staff have resided in communities that we've been serving. And some of them have actually gone up within the business and our organization to lead programs, become program delivery managers, people who are now providing guidance at a provincial level to SIMER managers, people who are providing support at a national level in terms of data quality. So there is indeed value in terms of building capacity at a local level. And I think there's value in seeing that trend over time, like the examples that I've just given you now. Thanks, Joni. Oh, we can't hear you, Joni.
Oops, my team muted me. I was just thanking you for your time, as I know that you're actually in Tanzania at the moment at a conference. So thank you so much. Your insights are always so valuable. I would love to talk to you right now, Batuke. And I know that CMMB have recently, or over the last 3 years, have gone through your own localization journey from being part of CMMB International to becoming a fully local organization within Zambia. I'd love to hear your insights about that journey and that process, and maybe some advice that you can share for other organizations looking to be on that same journey.
Thank you very much, Joni. Thank you to the rest of my colleagues, the panelists and the listeners. Wonderful opportunity, honored to be here. First of all, as we've already heard, issues around localization have been part of the agenda, the development agenda, for a number of years. I believe for more than 15 years now. And so as I went from one position to another, from an international NGO, which then became local, it became imperative that even when I joined CMMB, that we need to have that conversation, simply because we need to be moving in the same direction that the development world is moving. And the reasons being very simple and straightforward: issues of decision-making, localizing governance and leadership, so that implementation that's taking place locally obviously then becomes sustainable. You don't have a situation where an international NGO always coming in, implementing, and then leaving. When the local organization's capacity has been built, it lasts forever, obviously working very closely with the government. And so we felt that we needed to move alongside, as governments are being asked to domesticate funding. It was important that we needed to localize so that even implementation goes along in the same direction. In 2019, we were registered as an autonomous and independent organization from our mother organization, Catholic Medical Mission Board Incorporated, based in New York. And this journey has been very participatory. All the different sectors of the organization have come together and contributed a thing or two. And as we became localized, registered in November of 2019, the board, CMMB Incorporated, started to look at, and the new leadership started to look at issues around strategic direction of the global organization, and to really ensure that the localization for the Zambia office is made real. The strategic direction of CMMB Incorporated, which really focuses on issues around subsidiarity, which is a Catholic social teaching. And easily said, I would define that as nothing should be done at a higher level that can be done at a lower level. That's the simple definition of subsidiarity. I'm grateful to the fact that as we have really looked at making that localization process and the transfer of issues around control and power, making all of that real, allowing decision-making to happen at the local level, building the capacity of the local board so that decisions are made here. It's not easy to transfer issues around power and control. And so I would really like to commend CMMB Incorporated for being able to do that, passing it down to us, the local leadership here, the local board, and indeed really redefining the support that needs to be provided to a local NGO. That was primarily considered to be a branch of the international NGO. What does that mean? It's really about redefining capacity development, capacity building, looking at building the skills that enable that organization, such as ourselves, to then be able to make our own decisions. We now have a memorandum of understanding. CMMB Incorporated is now our donor, while we are part of the association. And so we call it being still maintaining our status as being a part of the global family. And so we have a global association agreement. The support services continue, and we through another agreement. But indeed, all of this being done in such a way that the country director, such as myself, I was transferred. Instead of being recruited by the US office, I am now employed by the Zambia board. And the next stage is really for us to change our name, because issues around ownership, branding, intellectual property, all of those things that need to be transferred are now being done. And with effect from the 1st of April, our new name is Access to Health Zambia. We continue to do business as Catholic Medical Mission Board Zambia. We continue to be a part of the global family, yet we are grateful to the fact that we are now standing on our feet, and we have to ensure that what we do is done within the confines of the development agenda at national level, as well as indeed at global level. May I take this opportunity to also be very grateful to USAID for entrusting us to go through a process of being a prime partner as a local NGO, but now moving from managing a cooperative agreement to a contract. And doing that process, holding our hands and explaining all the different terms, what we do, when, it's really been very nice to have this great partnership that we heard Dennis talk about earlier. So that's basically our very interesting journey that we believe continues. And the next time that I'm having this kind of conversation, I'll be representing Access to Health Zambia while doing business as CMMB Zambia. Thank you.
Gosh, thank you so much. I think that's great insight around redefining support and around kind of almost staying within the family. It's sort of as you grow up, I guess you leave the family, and we're really excited to be working with you as Access to Health Zambia. So all the best with that, and thank you so much for sharing your journey. So our last panelist, certainly not least, is Amita, and she is joining us from the States. So thank you for waking up early to join our panel today. And I really thought that you could help round off our conversation as a representative from FHI 360, one of the largest global implementers. So really looking at localization and locally led development, which is interpreted in so many different ways by different stakeholders. So could you maybe speak to us about your perspective on locally led development, what it means as a global implementer, both now and the future vision?
Thank you so much, Shoni, and thanks so much for having me. As you mentioned, my name is Amita Mirothra, and I'm a Senior Technical Advisor for Capacity Development with FHI 360, focusing on our meeting targets and maintaining epidemic control, or EPIC project. FHI 360 is an international NGO implementing health and development programs globally, and in my role, I work with FHI 360 field teams across the globe to support local partners to achieve their own capacity strengthening goals. I've been with FHI for about 15 years now and had the privilege of interacting with actually 2 of our 3 implementing partners on this panel in a collaborative role. So great to see the connections and also hear about the journeys of each of these institutions. I think we, and when I say we, I mean all implementing partners, regardless of where their headquarters are based, have always known that community engagement and promoting local solutions is the right way to go. And particularly coming from the HIV implementation space, the refrain, "Nothing about us without us," has underscored the importance of community involvement in all of our programming. There's a few different themes that kind of come together at this moment in time that makes this unique. And I think Dr. Dennis Mali had kind of touched on these. We've seen a focus on localization in the past through USAID Forward, PEPFAR's local partner targets, and other such initiatives. But now we're coupling that focus with a global focus on decolonization of aid and a deep recognition at USAID, Joni, as you mentioned earlier, of the challenges in the regulatory framework that makes programming, the challenges that the regulatory framework presents that makes making localization programming challenging, and a commitment across all implementing partners to examine how to lead with localization. So I'm not the right voice or perspective to discuss decolonization of aid or diversity, equity, and inclusion, but I would be remiss not to note those connections to locally led development, or how addressing colonization of aid and power imbalances dovetails with making our work more locally driven. Along with this increased focus on DEI globally, we're also seeing some real substantive change in our main donor, USAID, as Dr. Mali just told us about how they will intentionally engage with communities, about how they will reduce barriers to partnering with USAID, and how they're working to reframe partnering mechanisms. Most notably, this is seen in their new acquisition and assistance strategy that came out, I think this week or last week. The new local partners capacity strengthening policy, and we've seen changes to regulations around competition, an emphasis on different types of award mechanisms, and a real concerted effort to address some of the key challenges that have been raised by local partners globally. And while I know colleagues at USAID and at implementing partner institutions will say that there are still challenges and barriers to partnering with USAID that need to be addressed, the policy changes that have been made are significant and will move the needle towards allowing greater engagement with communities. So how do the programs that I support respond to these changes, and what's our way forward? As I noted, I work on the EPIC project as a senior technical advisor for capacity strengthening. The EPIC project operates HIV programming in over 30 countries with interacting with over 200 local partners across these countries. The EPIC project operates in these past few years, our program has helped to support around 5 local organizations to receive direct funding from USAID, served as a mentor or capacity strengthening resource to an additional 10 organizations who are implementing with direct funding from USAID, and supported over 30 institutions to help identify ways and mechanisms to sustainably finance their own future through social contracting, corporate social responsibility, or developing social enterprises. So as more and more of the programming is implemented directly by local institutions, I see our role as FHI 360 changing. Not necessarily contracting or expanding, but just changing. I see a shift towards INGOs using our influence and our convening power, our position and expertise to facilitate locally led solutions, and using our voice to amplify the solutions that we've identified or that our communities that we're partnering with have identified. I see how we can support the adaptation of solutions from one context to another, and how we can support local ecosystems to identify and rapidly share innovations across contexts. I also see that we need to take a hard look at our own value proposition to partners who are locally or regionally based and therefore can provide more locally led programming. What do we have to offer that isn't already available in country? Are we the best place to deliver what's asked? And how can we be supportive, but not in the way of a solution? I think one of my colleagues just asked, what can be delivered locally? And I think that's a great question to continue to ask as we move forward. Looking forward, I think we also need to consider how to be a safety net. We know that contexts and priorities change, and hard-earned gains and policy change, outreach, or service delivery are fragile. We've seen governments that commit to social contracting, then donors leave, and then the governments change their minds and leave communities without the vital resources and service delivery we know civil society organizations provide. So one big question for me is, how can the INGO community continue to provide the support or serve as a safety net when there is inevitably change? So these are just a few thoughts from me on where I see the work of FHI 360 now and in the future. And thank you again so much for having me today.
Gosh, thank you so much. Your remarks were filled with so many insights. And actually, I think we're going to the Q&A section, and I think you've answered a couple of the questions that people asked as we went. So I think we have about 10 minutes for questions. So how about I dive straight into those? So some of the questions that I saw was really around what is the role for our international implementing organizations. Is there still a role for them within this changing field? So I think that, Amita, you've mentioned a lot of great things that you can really still do. And Batuke, I wanted to maybe throw that question to you, as you are still so very connected to your original mother organization. What kind of things do you still think that you can get from INGOs?
Thank you very much, Johnny. One thing that we realized we needed to do is to really look at what role they can play now. And through that process, we had an assessment of what would be the capacity gaps that we currently have in different areas, starting from governance, leadership, finance and administration, operations, programmatic, issues around what technical areas, issues around procurement, and so on. So we really went through this organizational vulnerability and capacity assessment. And after we looked at our vulnerability areas, or the areas that we need support in, and then we presented it to them and said, this is the direction that we really need a lot of support from them. So I think even as we are priming, you find that most of the time we will have a sub-partner who's an international NGO. Within that space, it's about constantly looking at how do you transfer knowledge that you have as a big international NGO and provide to us, the local NGOs, so that then we can do what the internationals can do. There's always room for innovation. There's always room for something else. There's always room for identifying another big problem that needs to be addressed.
Thank you. I guess it goes to your original point about redefining support and looking at that power imbalance or rebalance. And then I guess some other questions have come through that are almost on the exact other side of the spectrum, and maybe I'll lean on you, Jerisha, to start the comments, which is really around looking at how do really small grassroots organizations get involved in this conversation, because organizations like BroadReach and Mothers to Mothers are local organizations, but they're bigger local organizations who have the capacity to take on the governance structures that are needed to accept large funding for large programs. So I guess the question is, what's the place for the really small local organizations?
Thanks, Joni. So I think to start us off, I can say that, there are multiple platforms at a local sub-district level, within communities, at a district level, where you are constantly engaging as a implementing partner. And a lot of this gives opportunity to smaller local partners who are in the field doing the work, but not necessarily funded appropriately. And I think it's through the constant partner engagement sessions that we hold on a quarterly basis. And now specifically in the era of COVID-19, where a lot more outreach has been done in the community, and a lot of the more targeted drive towards reaching our gaps towards 90-90-90, a lot of the interventions are more community driven. That has given organizations like BroadReach an opportunity to engage a lot more with some of these smaller organizations, and also start gathering that information around databases with the stakeholders like Department of Health, so that we can continuously have those conversations around those engagements. So I think there's definitely opportunity for us to do a lot more of that going forward, specifically as our program evolves, a lot more out of the facility and into communities, because that's where our people are, and that's ultimately who we are serving.
Thank you so much. Okay, let's look for another question. Or actually, Paula King, I wondered if you had a response to, how we can further engage these smaller grassroots organizations.
I think Tricia has covered a lot based on the stakeholder engagements. There are a lot of forums where we are engaging as local implementing partners. Another thing that I'm seeing, if we have the bigger bodies like Ministry of Health, where we have the community technical working groups, all the stakeholders at local groups, they are invited in those. And then we have the platforms for learning and sharing. Learning and sharing is very important, because if organizations like BroadReach Mothers to Mothers, like we mentioned, the journey that we have gone through, if we are given an opportunity to share those experiences in those forums, I think it's a great opportunity for other grassroots organizations to learn more. Thank you.
Thank you. Okay, this is quite a long question. This is from Dina. All our other ones have been anonymous so far. One of our speakers raised the question of structural and regulatory challenges that inhibit localization. What role does project-based funding play in keeping organizations dependent on international organizations and prevent them from building up organizational capacity? Do people see that there is a possibility for more core funding for organizations to become a reality within their local agenda? So I guess the core of the question, I think, here is around looking at more funding for core operations of these local organizations. Does someone want to jump in on that?
Okay.
Okay.
Yes, I think one thing that maybe I might be answering, another question that came in, what would be the imagined challenges that would come out of this? Most of the time, we are so heavily reliant on international funding, even if we are local NGOs. And I think this is the time that we begin to challenge local funding opportunities. We really need to have everybody coming in and recognizing that the way we have identified the capacities for local to implement, the same narrative is what we need to use for locals to fund. And I think countries are growing slowly. Specifically, I might add Zambia at this juncture. And I think we have a great opportunity to really look within ourselves and see how can we look at our situation and find ways of, one, the government continuing to increase funding towards issues around what we are working in. And I'm glad to say the current government is doing that. And then aside from that, anybody else, most of the funding that we get from internationals come from individuals. So why don't we as individuals get into that space as well?
That's great. That actually answers a couple of other questions that have come through. I think that this next question, maybe we'll start with you, Dr. Mali, which is asking, through your career, what have you seen as the biggest opportunities through local engagement?
Thanks. Yeah. So my career, just to describe briefly, so back in 2012, 2011 in South Sudan, we were working around the USAID Forward activities. And at that time, I was able to see, able to collaborate USAID and Nespresso, providing funding to, local farmers to grow coffee in South Sudan, a post-conflict country. I think that was an amazing, act of partnership, even at a post-conflict country, probably, active conflict. In Namibia, where I did some work with local partners, basically, through regulations within USAID restricting eligibility to only local partners, it was able to bring on board, civil society organizations and key population-led entities to come together to design and implement services for themselves. Here in South Africa, where I am also an AOR, or put simply, a program manager for one of the APACE mechanisms for providing care and treatment for over 300,000 people. Now, this is some of the activities done, but I can tell you we have seen tremendous results out of this local engagement. Number one, it has been very satisfying to the local communities themselves, and the treatment outcome for the people, for the beneficiaries of designing these activities for, have been really comparable to what we have been seeing with the international partners. Nobody would have imagined back in the days that we could run a large HIV care and treatment program through local partners. But by using USAID regulations, intentionally restricting those eligibilities, we were able to offer opportunities for local partners. Now, also to add is that when the local partners get out there, what we have seen is that they have been able to mobilize fairly quickly because of their local context. They know the environment, they know the people, and so they have deep understanding of the places where they work. They have local skills that they don't have to go and harness from some places. So that has translated into what we see as, quick project initiation and turnaround time. There was a question which was asked, I think, about, the role of international organizations. And I just want to say, last year in November, we had the 4th local partners meeting. USA does this intentionally. This is another way of us trying to, number one, address one of the key concerns raised here. I think Batuke had mentioned earlier on the importance of sharing your knowledge across a wider platform. The local partners meeting organized by USAID Southern Africa brought over 800 local partners from 53 countries for a whole week. Dirisha, I was able to meet you there. It was a great opportunity. We had a lot of abstracts from local partners implementing as far as the islands of Lake Victoria in Uganda, bringing what they do with fishermen communities in that place and demonstrating their skills. So that is exactly how, we were able to discuss some of the challenges that they face, some of the strength, the quality of report, the quality of data, the quality of program, the impact of their program across a larger portfolio, across a larger program. So USAID has all of these opportunities. Now, in terms of international organizations, we have noticed that, localization is a process. Organizations embark on the journey to localization across different time zones. Like a key example is CMMB, from where they started off to now in April. Hopefully, if I'm in Zambia now, I'll be seeing Batuke as a completely different person affiliated to a different organization. That has been a journey. So organizations come through this journey over time. We recognize that, and at USAID, we do pre-award assessment to identify those risks, develop risk mitigation strategies with the partners, and we use the skill set of some of the international organizations to do this identification and develop, together with the partner, what mitigation strategies are required to go forward until you're able to take on more resources.
That's fantastic. Thank you so much, Dr. Marley. As always happens with these discussions, just as we really get into the meat of it, we start running towards time. So for those of you that we haven't had time to directly answer your questions, I'm terribly sorry. We'll look out for the report that we'll send afterwards, that we'll try and answer some of those questions. So we just have enough time for each of our speakers to maybe give us their parting thought or their parting learning that they would like to share with our wider community around localization, the value of localization, what they have learned. Why don't we switch it up? Amita, would you like to go first?
Sure. Again, thank you so much for bringing together us to discuss today. I think what I've been taking away from this is realizing that we all recognize the benefits of localization and know that this is good development. It was really great to hear about the journeys of each of the different organizations and some of the learning that's happened. And I think all of us have a part to play in making programs more locally led, whether we be based in Zambia or be based in the US, figuring out how we can make our development programming more locally led. I think that being able to have more forum like this, where we can share and interact and share about the process. I think Dr. Mali just was talking about knowing that the end goal is good, but getting there sometimes there's a lot of challenges and bumps in the road. So what are the learnings that we have in going through that process that we can share with one another and continue to learn? And equally, it's important just to ensure that we continue to improve and sustain the gains that we've made in making sure that programs are more locally led. So more conversation about how to do this in a respectful, methodical, and consistent manner, I think would be really great. Thank you so much again for having me today.
Thank you. Those are great insights. But 2K, would you like to sum up your thoughts?
No, thank you. And I think summing them up will be in a response to one of the questions. What would I define as success for our localization process? And I really believe that once we can see decision-making processes happening at different levels in the communities and indeed within the organization, continued partnership, and indeed all of this towards the main goal that we're working towards, which is domesticating all our aid and at the same time ensuring that our efforts are sustained. Thank you.
Well, Paula King, what would you like to leave our audience with?
Thank you, Johnny. Listening to everyone today, I think it still stands that localization, for it to be sustainable, we need collaborations. We need also to have a one goal. I think everyone here was talking about one goal of localization. So for us to be achieving the goal, let's stick to the goal that we are looking forward to, and let's collaborate. Locals, internationals, we need each other. Thank you.
That's fantastic. Yeah, collaboration is a very important value. Jerisha, would you like to
Thanks.
share?
So, I'll sound like a broken record, but I'm going to say it again. Great value in long-term localization, specifically leading to sustainability of programs, especially as we see our programs evolving over time and the pivots that happen, moving towards more health system strengthening models. And I think the other thing, like my colleagues are saying to all local partners, is there should be more, there's more strength in numbers. We should foster relationships amongst ourselves for sharing, learning, leveraging off each other so that we can be successful, instead of creating competitive environments, that may not necessarily make it as easy to collaborate with each other. And I think the last fundamentals is that you can't do localization without relationships and building local capacity within, the staff on the ground. Thanks so much.
Thank you, Jerisha. Dr. Marley, would you like to wrap us up with your last perspective?
Thank you. Most of the panelists are actually coming from the PEPFAR-funded programs, which is really great. So I'll mention about PEPFAR, and I can tell you that having seen our local partners grow 300% from where we were in 2019 at 40 to about 170, there is an opportunity, and now we should start thinking about localization at a sub-national level. So how can we actually do localization at a district level to be able to get to those communities out there. Just to say that, USAID is fully committed. We are at a place where we've never been. We are doing more co-creation. We are issuing so much RFI, trying to listen to the voices, capabilities, and networks out in the community. I urge every entity out there that is willing and able to contribute to its development challenge at its community level should be able to pick up those opportunities and engage. Form alliances and engage.
Gosh, thank you so much. I think that sort of the theme of this whole webinar has really been around listening to voices, and whether it's listening to the voices of our funders from USAID, PEPFAR, our international organizations, or our locally led organizations. I think it's really inspiring to understand the perspectives that we all come to, and the fact that we're really all working for one common goal. So I've had a really great time hosting everyone here today, and thank you to our esteemed panelists, everyone that has joined us. We will be sending out a key takeouts document. You'll get that in the next couple days with some key highlights that we pulled out, and this webinar will also be available on demand if you think any of your colleagues should also get to listen to the conversation. So with 30 seconds to go before we hit time, I just wanted to thank everyone and have a wonderful rest of your day.